when we think about myeloproliferative diseases, we often think of these as generally speaking, progressive diseases. We don't have too many treatments that modify the underlying, the natural history of the disease to a consistent degree. And there's been a lot of effort to look into kind of things and factors that predict progression. And early on, we've looked at clinical features and lab abnormalities, some demographic features, as well as more recently we've looked at some genetic features that can help to understand if ET is going to progress to PV, PV to myelofibrosis, ET to myelofibrosis, and any of those entities progressing to acute leukemia. And when you look at these clinical features, it's often kind of lab abnormalities such as leukocytosis or anemia or thrombocytopenia that predict for the disease turning into a kind of a more advanced phenotype. And but when we think about progression to acute leukemia, a lot of times it really is the genetics of the disease that drive that. And we see that it's these high-risk mutations in genes like SRSF2 and ASXL1, to mention it too, as well as cytogenetic abnormalities that predict for the disease becoming more unstable and possibly turning into acute leukemia. We have developed a few prognostic models to help predict for leukemic transformation, and those can be useful to kind of identify those. And I talk a little bit about that as well. And then more recently, there's been kind of this personalized prognostic model that's been proposed that factors in a lot of different features, clinical as well as molecular features, to try to kind of get a sense for what are the possible outcomes with these diseases. And this was a pretty big undertaking to try to factor in all of these different things. And in doing so, we can see that it really isn't one thing. It's genetic factors, it's clinical factors, and if you put those all together, you can get a sense of the possible different outcomes. And that comes with an online calculator that can be used to come up with an MPN personalized risk score. But beyond clinical and genetic factors, I think what's very interesting is the kind of increasing understanding that inflammation plays a role in the natural progression of these diseases, and not just progression, but also initiation. And so I did want to spend a brief second highlighting some of these inflammatory factors, because I think there's really interesting work that's going on that may allow us to target some of these different inflammatory pathways and maybe halt progression going forward. And so a couple of the things I wanted to kind of focus on is one, this role of TNF alpha seems to be important, and maybe an altered kind of suppression or regulation of TNF alpha creates this heightened inflammatory environment that allows MPNs to ultimately come along and progress. And another cytokine that's been implicated is IL-1 beta, which seems to have some interesting role in maintaining and promoting survival of the MPN stem cell. Interestingly, beyond just these cytokines that we think are playing a role, we're also finding that people that have genetic alterations to have them kind of live in a state of heightened inflammation are more prone to developing myeloproliferative disease. And so people that have single nucleotide polymorphisms and the IL-6 receptor seem to be more prone to developing MPNs, and similar with some microRNA expressions that allow for a heightened inflammatory state. And I think that just goes to show that the inflammation really is, whether it's exogenous or endogenous, really promotes survival and progression of these diseases. And perhaps this is a different avenue we can take when trying to halt these diseases in their tracks.